Hey guys, this is Dr. Hub. Today we'll look at the extracellular. The extracellular fluid versus that of the intracellular fluid. So first we'll look at the extracellular fluid. Short we are writing at ECF. So how is the sodium level? Sodium levels is about 142 milliequivalents MEQ per L. Then comes the potassium. Potassium is 4 MEQ per L. Then the calcium is 2.4 MEQ per L. Next is the Cl. The Cl is about 103 MEQ per L. Then comes the HCO3. The HCO3 is about 28 MEQ per liter. Next is the phosphate, the PO4 3-, that is it is 4 MEQ per L. Then glucose, the glucose is about 90 mg per DL. Then comes the proteins. The proteins is 2 gram per DL, 5 milliequivalents per liter. So how is the pH? The pH in terms of the extracellular fluid is 7.4. And how is the osmolarity? The osmolarity is about 282 milliosmoliter per liter. Then the major cation. The major cation is sodium. And how is the major anion? Major anion is Cl-. Next, let's look at the buffer. The buffer, if you see, it is HCO3-. And what is the most osmotically active ion? Most osmotically active ion is nothing but the sodium plus. Next we look at the ICF. ICF is nothing but the intracellular fluid. In ICF there is sodium. The sodium is nothing but the 10 milliequivalents per liter. Whereas in extracellular it was 142. The potassium in terms of the intracellular fluid, it is going to be higher, that is 140 milliequivalents per liter, whereas in extracellular it was 4. Then comes calcium. The calcium in intracellular fluid is very minimal, that is 0.0001 milliequivalents per liter. And looking at chloride, the chloride is 4 MEQ per liter per L. Then HCO3 is 10 MEQ per L. Then comes the phosphate, the PO4 3-, this is a 75 MEQ per L. And then there is glucose as well. So this glucose is 0 to 20 mg per DL. Then comes the proteins. So what about proteins? The proteins is 16 gram per DL, that is about 40 MEQ per liter. Then let's look at pH. The pH is 7. Then what about the osmolarity? Osmolarity, this is going to be about 281 milliosmol per liter. Whereas in case of the extracellular it was 282. Now let's look at the major cation and anion. So major cation and the anion. The cation is potassium and the anion is the phosphate. So how is the buffer? The buffer here is the protein, whereas in the extracellular it was HCO3-. So most osmotic active ion. So the most osmotically active ion. So in terms of the extracellular fluid it was sodium, whereas in terms of the intracellular fluid it is going to be the potassium.